Good afternoon, everyone. Welcome. My name is Jason Marzak, and I'm the director of the Agent Arch Latin America Center at the Atlantic Council. And welcome to this discussion on the race to vaccinate Chinese vaccines in Latin America and the Caribbean. First off, a special welcome to Adrian Arsht, the executive vice chair of the Atlantic Council and founder of the Agent Arch Latin America Center and also the Agent Arch Rockefeller Foundation Resilience Center. Adrian is joining us today for this conversation, given how important it is for our region moving forward. Some quick framing. At the end of this month, China will have supplied more than 165 million COVID-19 vaccines to Latin America and the Caribbean, with Mexico, Chile, and Brazil receiving significant shares of those vaccines. Amid acute global shortages, Chinese vaccines are among the most, or sometimes the only available product in many regional countries that are struggling with the pandemic. In the meantime, rapid immunization in the United States is beginning to generate excess supply potentially available for exports. And of course, the Biden administration has now pledged to send 80 million doses abroad in the coming months. As we've witnessed the past year and a half, although the pandemic is first and foremost a health crisis, its implications are frankly multidimensional. They're socioeconomic, and also, as we'll discuss today, they're geopolitical. And today's event aims to explore some of the implications as we look at this growth of Chinese vaccines across the region. How do these vaccine agreements work? Are regional perceptions of China becoming more positive due to vaccine support? Why and how should the US respond? And is vaccine access a new era of geopolitical competition? Or can it be a rare opportunity for constructive collaboration and coordination? Today's discussion, we aim to provide a deeper, more up-to-date, and also nuanced analysis on these issues. And to do so, we have speakers that bring a mix of regional and thematic expertise on issues from health to US-China relations to China-Latin America relations. I'm delighted to begin by welcoming the Honorable Dr. Frank Anthony, who is Guyana's Minister of Health, where he is currently leading the fight against COVID-19. Minister Anthony has decades of experience in Guyana's health sector, and he's also a former member of Parliament. Ambassador Jorge Heine has served as Chile's ambassador to China, India, and South Africa. Ambassador Heine is a renowned expert on China-Latin America relations, and he also currently serves as a research professor at Boston University's Party School. As well, Ernesto Londonio, joining us from Rio, is the Brazil bureau chief at the New York Times, where he also covers the Southern Cone and has written about Chinese vaccines in the region. And we also have Dr. Jennifer Bowie, who is joining us from the RAND Corporation, where she is a senior policy researcher and also expert on health in China and the US. And this conversation will be guided today by Pepe Zhang, who's an associate director in the center and also our lead for work on China and COVID-19. Before today's event, we asked you to submit questions and comments in advance of our discussion, and we'll begin with a lightning round of Q&A. But first, as well, at the Agent Arch Latin America Center, we take great pride in shaping policy debates around major transformational issues through our timely and forward-looking analysis and high convenience. Our mission has led us to focus on China, the Caribbean, COVID as top priorities in looking at the future of the hemisphere. Just on the issues of China and COVID, we produce 5 reports. We produce a weekly newsletter, a vaccine tracker, and over 20 public and private just in the last 6 months. One conclusion is that as a longstanding partner, the US can and should be playing a more active role in facilitating vaccine access in the Western Hemisphere. We have a unique opportunity to lead and helping the region at this critical moment. This should be done not so much out of just the pure competitive dynamics with China, but also a partnership, the need for a partnership-based approach to the region. We've seen time and time again, regional recovery, regional prosperity is also in the US's interest. With that, I will turn it over to Melanie Chen, a board member of the Atlantic Council, who also is the inspiration behind our Caribbean initiative, to have a one-on-one conversation with the Honorable Dr. Frank Anthony, Guyana's Minister of Health. Over to you, Melanie.
Thank you, Jason. As Jason mentioned, the Biden administration announced that it will begin sharing 80 million vaccines in the next few weeks, which comes at a time when several countries in the hemisphere, particularly in the Caribbean, are seeing rapid increases in coronavirus infections. To discuss some of the implications, as well as speak about where the region's states are receiving vaccines, is the Honorable Dr. Frank Anthony, who is Guyana's Minister of Health. Minister Anthony has decades of experience working within Guyana's health system and administration, including working to defeat HIV, TB, and malaria in his home country. Minister Anthony has also served as Guyana's Minister of Culture, Youth and Sport, and is a long-time servant in Guyana's Parliament. Minister Anthony, welcome. Since the onset of the pandemic, Guyana has needed support from its allies to boost its public health sector. First, it started with needing ventilators and testing kits, and now the focus has shifted to vaccine acquisition. Over the past year, which countries have helped Guyana during this process, and has help from these countries come via donations or purchasing agreements?
Thank you very much, Melanie. Thank you for having me on this program. First of all, allow me to thank the Atlantic Center for inviting me to participate in this program. Uh, as you said, there are a number of countries that would have helped assist Guyana since the pandemic started. You know, we had our first case the same day that the WHO announced that um, this is going to be a global health emergency on the 11th of March 2020. And since then, we have been working to make sure that we can contain the case. We were totally unprepared because with that very first case that we had at our main hospital, about 30 other persons got infected or got exposed because we didn't have PPEs. We didn't know what we were dealing with. And so that's how our pandemic, if you like, our patient zero started here in Guyana. Over the past year or so, we have had assistance from a number of countries. Assistance from Japan, for example, we got a grant of $1 million. From India, we got $1 million plus 80,000 doses of AstraZeneca vaccines. From the government of Qatar, we got a field hospital worth approximately $1 million. We also receive assistance from China, where we got PPEs, and we also got 20,000 Sinopharm vaccines. And from the US, we have had a repurposing of one of the USAID grants in Guyana to allow us to fight vaccine hesitancy in Guyana. So with the assistance of the Johns Hopkins University, we have a breakthrough action program for malaria, and those resources have been repurposed, if you like, to deal with vaccine hesitancy. So we run a daily column dealing with mythbusters, and that is helping to improve our uptake for vaccines. We also would have had a donation of PPEs from the US government. And we just today, we receive an additional set of freezers that is going to complement our ultra cold chain here in Guyana. So we have been working with a number of partners, and we are very pleased that we could have gotten this assistance. In addition to countries helping us, we have worked with a number of multilateral organizations such as the UN, PAHO, WHO, who's helped us with securing technical expertise and also assisted us in procuring equipment. We have also worked with the IDB, the International Financial, so IDB and the World Bank has assisted us in getting some resources for us as well.
Thank you, Minister, for a very comprehensive answer. I have another question. Guyana has recently seen a rise in COVID-19 infections, similar to some of its other Caribbean neighbors, meaning that there's an urgent need for your country to acquire more vaccines. Can you tell us about the situation in Guyana and also in Jamaica and Trinidad and Tobago? As infection rates continue to rise, can you describe what you hope Guyana's allies will do to help curb the spread of COVID, as well as help with vaccine acquisition?
So indeed, we have seen a number of cases, and as of today, we have close to 2,059 active cases in Guyana. We have, of those over the last 24 hours, we've had 110 new cases. And of those, we have approximately 96 persons who are in hospitals. 31 of those are in our regional hospitals, and we have actually built a specialized hospital to take COVID patients. That hospital, we have a capacity of about 198 beds with a 25-bed ICU. And in that particular ICU, we currently have 19 patients. So what we have observed over the last couple of months is that there've been an increase in hospitalization. We have seen an increase in the severity of the cases, and ultimately we are seeing more deaths. As of today, we've had uh, a total death of 360 persons in Guyana, and we've had the overall cases since we first started in March last year. We have currently 16,239 cases in Guyana overall. Of course, most of these persons have recovered. We have had 14,180 persons who have recovered, but with the increase in cases, we have to keep monitoring that and make sure that we have those cases under control. In terms of vaccination, we have been able to source vaccines through COVAX, through some bilateral donations, such as we got our first 3,000 doses of vaccines from Barbados, who themselves got it as a donation from India. They kindly gave us 3,000 doses initially. And with that, we started our vaccination program in February, uh, starting immunizing healthcare workers. And after that, India donated 80,000 doses to us, and we received 20,000 doses from the Chinese. And we ourselves went ahead and we purchased vaccines. So with that, we have been able so far to immunize about 184,319 persons with their first dose vaccine, which amounts to 37.9% of Guyana's adult population. And with second dose, we've been able to do 54,691 persons, which would account for 11.2% of Guyana's adult population. So we have been steadily pushing the vaccination drive here in Guyana, and we are hopeful that with additional vaccines, we can get closer to herd immunity. So as you know that with COVAX has agreed to give countries, especially those AMC countries, vaccines for 20% of their population. But because of the challenges with COVAX, they have not been able to deliver all of these vaccines. But even with 20% of the population, many countries would not be able to reach herd immunity, which the experts are saying should be around 80%. Uh, you have to vaccinate at least 80% of your population. So there's still going to be a substantial challenge in terms of immunizing enough people to get to herd immunity. And what compounds that, there are two factors. One, most of these vaccines that we currently have are not available for children. So unlike in the US, where you have Pfizer that has now been licensed to do vaccination up to 12 years of age, the vaccines that we are using, it's just for adults. So that would pose a challenge in getting the population closer to herd immunity. So that has been, one of the challenge. Having access to vaccine is really a big challenge, and to get enough vaccines to move the country to closer to herd immunity is really a big problem. While we have that's our situation basically in Guyana. In other countries in the region, we have seen that they too have challenges with increase in cases. In Jamaica, for example, they have currently 47,959 total cases, and they have 917 deaths. Over the last 24 hours, they would have had 60 new cases with 5 new deaths. And their vaccination rates, they have 164,703 persons with first dose, with 14,430 as the second dose. When you look at our neighbors, Suriname, you have about 13,111 cases with 249 deaths. And they have started to see a surge in cases with currently over the last 24 hours, they've had 183 cases with 4 new deaths. And again, vaccination rate in Suriname is relatively low. So at 74,120 first dose vaccines and 9,254 second dose vaccines. In Trinidad, as you know, again, there is a surge there of cases, and they currently have total cases about 20,017 with a total of 375 deaths. Right now, over the last 24 hours, they would have had 573 new cases with 10 new deaths. And again, vaccination in Trinidad is relatively low. They're at 67,478 first doses with 1,179 second doses. I think this morning at the World Health Organization, Dr. Etienne, the director of PAHO WHO, she made a startling contrast. She said, in the region of the Americas, we have had close to 1 million deaths in the region of the Americas. And we have only been able to vaccinate about 3% of our population. And I think those numbers speak to what is happening in the region, despite countries' best efforts in acquiring vaccines. So we can change that, and we can reduce the number of cases that we are having. We can reduce the deaths that we are having, the hospitalizations that we are having. And the way to do that is to use one of the tools that is available, and that is vaccination. We have seen what has happened in the US when you have mass vaccination. You now have a drop in the cases, and there's a turnaround of the pandemic in the US. And I think a lot of countries would like to have access to vaccines so that they can do the same for their countries.
Thank you, Minister, for your time. Now we'll head to our lightning round session. Over to you, Pepe.
Thank you, Melanie. Thank you, Melanie, and thank you, Minister Anthony, for this very insightful conversation. Melanie, so great to have you always with us, and Minister Anthony, thank you for leading the fight in Guyana against COVID-19. Good afternoon, everyone, and my name is Pepe Zen. I'm the Associate Director with the Adrian Arts Latin America Center. I'll be moderating the rest of today's event. Really looking forward to an exciting exchange with all the distinguished panelists, including Minister Anthony, and with us, Ambassador Heine, Dr. Bui, Ernesto, welcome and thank you again. So as Jason mentioned, we'll start off with and Melanie mentioned, we'll start off with a lightning round. I'll be asking a series of 4 questions to all the panelists. And please, if you have an answer you'd like to venture a guess, please raise your hand, and I will make sure that I call on you. If no one volunteers, I will volunteer someone in the group. We try to make things a little more interesting and exciting, and the winner of this lightning round will be receiving a priority, a special invitation to join the Atlantic Council in-person event, COVID safety protocol permitting a few months from now. So there's a lot at stake here. Now, the first question we had, and we collect a lot of these questions from folks that submitted questions from the audience that had the event, so we really appreciate you doing that. Tying off of what the minister was saying about COVID death and how Latin America is really disproportionately being affected by COVID-19, the first question is, of all the global death that's been happening, what's the percentage of the death that's happened in the Americas to our panelists? And for reference, Latin America represents 8% of the global population. Does anyone want to?
I think it would be about a third, because if we think about 3.4 million deaths right now globally, Latin America and the Caribbean, we have more than 1 million deaths. So
That-
it's approximately or a little bit under a third,
Thank
which really paints the picture there for us. And bearing in mind that only 3% of our population has been vaccinated.
That's right. And I saw Ambassador Heine also raising his hand. Did you have a similar or a different number in mind? You're on mute.
To put it in context, this is twice the number of deaths in the Spanish Civil War. I mean, that gives you a sense of perspective of how bad the situation in Latin America is. It's 4 times what we would normally expect according to the distribution. So my point is Latin America is ground zero in the worst pandemic in a century, the worst humanitarian crisis since World War II, and the worst crisis in the region in 120 years, according to ECLAC. This is a signature event in the region's history. And the way it has been managed and the way other countries have reacted to it will be remembered for a long time.
Thank you, Ambassador Heine, for putting that number in context. And Minister Anthony, you're absolutely right. The number we saw as of last week was 35%, so very accurate. Thank you, thank you. Now we'll move on to the second question, is lightning round. In Latin America and the Caribbean, there are 27 countries that have formal diplomatic relations with China. Of these 27 countries, how many of those do you think are either negotiating to receive Chinese vaccines or have received Chinese vaccines? It's a tough one.
I don't know how many, but I can tell you we received some.
Thank you, Minister. I'm going to call on Ernesto since you haven't had a chance to venture in the first question. What would be your guess?
Sure, Pepe. I don't know the exact number, but I will say that it's been striking that countries that don't have diplomatic relations with China, and there's just a handful in the region, including Paraguay and Honduras, have expressed interest, and the frenzy for vaccines and the huge demand for vaccines has caused these governments and these political establishments to rethink whether siding with Taiwan makes good sense for them. So we've definitely seen some interesting overtures, both from the Honduran president and from the government of Paraguay, expressing an interest in finding any way to negotiate vaccine supplies from mainland China, which I think has really opened the door to Beijing to do something it's been working very hard to do, which is isolate Taiwan diplomatically. So far, neither of those two countries has taken, sort of the bolder move, which is to dump Taiwan and forge diplomatic relationships with Beijing. But I think many people in the region are wondering if this is going to give the Chinese enough leverage to make that happen and to score important diplomatic victories.
Thank you, Ernesto. These are great points, and you've written extensively about that. So hopefully we'll be able to come back to you later in the conversation about some of these points. But going back to the earlier question, of these 27 countries that I mentioned that do have diplomatic relations with China, according to our calculation, it is 15 of them that are either receiving Chinese vaccines or negotiating to receive vaccines. Now, the third question, very quickly, we have a vaccine tracker that we put together, our team here at the Adrian Arce Latin America Center, to look at not just Chinese vaccines, but just global vaccines and their coverage in Latin America and the Caribbean. What we've seen in absolute terms when it comes to Chinese vaccines specifically is that Chinese companies have pledged to supply 250 million doses to the region. Now that's numbers in absolute terms, and we're looking at Chile, Mexico, Brazil being the top recipients in absolute terms. Now the question is about top recipients in relative terms. Which countries, which will be the top 3 countries in your view that are the top recipients in relative terms, meaning the vaccine coverage of their population? Another tough question. Anyone would like to venture a guess?
Chile is at the top in terms of getting Chinese vaccines. And Chile is also the country in the region and one of the countries in the world that has vaccinated most people. More than half of the population in Chile right now has been vaccinated.
Thank you, Ambassador. And Dr. Bui?
Yeah, I think the top 3 would be Chile, Peru, and Argentina. That would be my guess.
Thank you for a guess. And Ambassador Heine, you're absolutely right about Chile being on top, a global champion, certainly a regional champion when it comes to vaccination. So a key question to consider here, obviously, in relative terms, is also the size of the population, which makes the calculation a little tricky there. Chile is very much on top. Even with the Chinese vaccines alone, Chile has the entire population covered with the 2-dose Chinese vaccines. And then according to our calculation, the second and third place goes to the Dominican Republic, which has 40% of their population covered by Chinese vaccines, and Uruguay with 25%. Once again, these two countries are relatively small in population size, so I think that's what changed the population, that changed the calculation. Very last question. The last question was about Chinese vaccine coverage in the region. Now we look at actual doses delivered by Chinese companies into the region. There was an excellent Financial Times report a couple of weeks ago about this. So the Western vaccines, the two Western suppliers to Latin America, AstraZeneca and Pfizer, according to this Financial Times study, has delivered somewhere around 59 million doses between the two of those to Latin America and the Caribbean. What do you think the number is for the Chinese suppliers?
Last I heard was 65 million.
Any additional guess? Dr. Bowie?
If you're talking about a donation plus the purchase, I think the total number of delivery so far is 65 million. The purchase is about 279 million. Is that that's I think not delivered, but the total of purchase so far.
Thank you, Dr. Bowie. You've certainly done your research. Thank you all for participating in this very interactive lightning round. We try to make our events interesting. Now we move to a more conventional panel of Q&As where you have more time to really share some of your thoughts and expertise on these relevant issues. I'd like to go to Minister Anthony first. Once again, thank you for joining this panel and taking the time to chat with us. Something I'd love to hear more about is what you mentioned earlier. You mentioned that China has been a partner for Guyana specifically when it comes to PPEs, when it comes to vaccines right now. What we'd love to learn more about is how these agreements, specifically the vaccine agreements, come about, right? So did China reach out first? Did Guyana reach out first? Was it a state-to-state conversation? Was it a state-to-company conversation? Please share what you know about some of these situations, specifically the Guyana case study. And I'll go to Ambassador Heine and Ernesto later on to some of your countries to share your thoughts on the similar question. Please, Minister.
Yeah, so I think there are two tracks here. One, in terms of donations of PPEs and a few pieces of laboratory equipment. The Chinese embassy here in Guyana reached out to the ministry and they donated those PPEs and, of course, the equipment. For vaccines, again, we've been talking to a number of companies to try to source vaccines. And one of the companies that we reached out to was Sinopharm. And through those conversations, we were able to secure the 20,000 doses of Sinopharm vaccines.
Thank you very much for sharing that information. Now going to Ambassador Heine and Ernesto, perhaps Ambassador Heine, will start with you in the Chilean case.
I think that the Chilean case is interesting because Chile has struggled quite a bit with the pandemic, and 2020 was very tough. At some point, Chile had some very high numbers in terms of infected people and also in terms of deaths per population. Now, what is interesting here to note is how this has been changing with the vaccines. Now, what has helped quite a bit is that Chile has had a long established system of administering vaccines countrywide, and that system was in place. Obviously, for that, though, you need vaccines. Even the best system is not good if you don't have the vaccines. And what Chile did well was that it started early. It contacted China, which had been providing quite a bit of PPE before that with mask diplomacy, so-called mask diplomacy. And Chile did, it seemed to me, three things right. It followed an anticipatory strategy, didn't wait for the vaccines to be ready or tested, but went ahead. In fact, some of the tests were done in Chile, and Chile funded some of them. That was one. Two, it was very much a collaborative thing, working with 3 foreign labs in phase 3 of the test of vaccines on Chilean patients, thus securing early delivery and favorable prices. And 3, it was pragmatic. It worked with labs from China, from the US, from the UK. And about 90% of the vaccines that Chile has gotten are from China, from Sinovac, CoronaVac. And what helped here very much is Chile's long-standing ties with China. Chile was the first country in South America to establish diplomatic relations with China as far back as 1970. And therefore, it had the sort of links and access that made this possible. So it seems to me there are important lessons there on how to move forward. And I think particularly the anticipatory strategy and working together with a variety of labs and not having any sort of ideological blinders was very important in this case.
Thank you, Ambassador Heine. Really a life and death and realistic issue, and interesting to see some of the similarities and differences between the Chilean case and the Guyana case. Ernesto, please share what you know about the countries you follow closely in the Southern Cone.
Sure. I mean, I think the Brazil is a dramatically different example. Considering what we saw in Chile, in Brazil, which has been one of the hardest hit nations in the pandemic, there was very little interest by the government last year to move aggressively and boldly to secure a spot in the vaccine line, when many countries around the world, including wealthy nations, were negotiating access to the vaccines that looked most promising. I think what the Chinese did was very interesting, noting that they had a government that was not only not interested in doing business with them, but like outwardly hostile toward China and outwardly dismissive of the Chinese vaccines themselves. They found an important foothold in the state of Sao Paulo, which is run by a governor who is a political rival of the President Bolsonaro. This was important because being in Sao Paulo allowed them to strike a deal with an important scientific institution which studied the vaccine's efficacy. So in Brazil, the Chinese had a population where the virus was, very contagious, and it was a very interesting proving ground for their vaccine. And they struck a deal with the governor, not even the federal government. Now, early this year, when it becomes clear that the vaccine looks like it's going to work, and, not only does the Chinese vaccine work, but it becomes clear to the Brazilians that they're not going to be able to get any of the other vaccines in any sizable numbers quickly. They realize they're stuck with the Chinese vaccine. And I think reluctantly, the federal government takes the step of appropriating the vaccine doses that the government of Sao Paulo had negotiated and distributes them across the country. So I think the Chinese walk away with a lot of leverage, and it's not only a public relations victory for them, because that led to President Bolsonaro and many of his allies ceasing what had been sort of, a rhetoric, a very anti-Chinese discourse, because they definitely realized that they needed the Chinese to save lives, and they needed the Chinese to move urgently in order to save lives. But this opened other doors for China. For instance, last year, the Brazilian government had all but made clear it wanted to ban Huawei, the telecommunications company, from participating in an auction here in Brazil to set up the 5G network. This was at the urging of the Trump administration, and it looked like Huawei was screwed, frankly. Come February, the minister who's running the auction finds himself in Beijing talking to executives at Huawei and Chinese officials. And what does he do? He pleads for access to more vaccine doses. So I think the landscape changed very favorably for the Chinese almost overnight. And they were able to not only score a public relations victory, but advance other interests they had that were unrelated to vaccines.
Thank you, Ernesto. That was super interesting to hear the Brazilian case, this interesting dynamic between the subnational and national government. I'd like to come back to you in a little bit about this public perception point, but tying to the other point you just mentioned about how this complements some of the existing Chinese engagement or initiatives in the region. Do you think at this point, is vaccine and health officially a new avenue of engagement for China, specifically in the case of Brazil, but in the region in general? And then I want to ask Dr. Bui a follow-up question related to that.
Yeah, and thank you. I'm really happy to be here. So I've studied the China's global health strategy for a few years and testified before the US Congress a couple of times. So from what I would just mention three things, just given the time. One is that China has expanded its global health assistance program dramatically in the last 10 years. China has been considered as a middle-income country until 2013, they have the largest aid from World Bank and from Global Fund till then. So in a few years, quickly, China becomes the donor. So from 2010 to 2018, China's global health aid expanded by 65%, basically outpaced every other country in the world. So that gives them a quite different type of narrative compared to the traditional donors. They come as a developing country, recently developing country. So they focus on economic partnership and win-win situations and usually less political ideology agenda. The second characteristic is that most of their support or aid are on bilateral base. 91% of their funding on global health are bilateral, only a very small proportion through multilateral efforts. And thirdly, the vaccine and medical device is part of the bigger package, of course. They also send out medical teams, training medical professionals, as well as provide the building hospitals and provide humanitarian aid. The vaccine is relatively new because China is not a stringent regulatory system in the eyes of WHO. So their vaccine to be procured by WHO will need to have additional steps for pre-qualification. And so far, China's pharmaceutical regulation is still in the process of harmonizing to other developed countries. So again, this is relatively new development. This is probably the fifth vaccine that's been procured by WHO. So in terms of motivation, it's similar to other countries, building soft power and protecting their economic investment, as well as building solidarities with countries. I'll stop there and answer the questions.
Thank you, Dr. Boyd. That was very interesting to hear these three characteristics you outlined and also put them in global and also historical perspectives. Interesting how the Chinese aid is seen from a global South perspective, being part of the global South. Now, kind of moving back to Ernesto, the question I wanted to ask you earlier and the point you mentioned, which is, and also Dr. Boyd mentioned this point about, in addition to some of the more traditional Chinese engagement with Latin America and the global South in general, which is more economic focus, we talk more about trade, we talk more about investment and lending. Do you think at this point it's safe to say that health and vaccine diplomacy is a new avenue of engagement? And I'll ask the same question to you, Ambassador Heine, after that, and of course, Minister Anthony, for your quick thoughts on the Caribbean case.
Absolutely. I think, the Chinese have for a number of decades had a constellation of business interests that has grown in scope and ambition. And I think the Chinese have been very sophisticated in leveraging, some deals and some interests against others. And I think the lines in the Chinese system between what is state-run policy and private enterprise oftentimes gets blurred, and oftentimes there's a lot of cooperation and sort of behind the scenes deal making that helps them advance one issue after another. I think it's critical to remember that for a number of years, the United States has been trying to persuade its allies in Latin America and the Caribbean that doing business with the Chinese comes at a price. And the Americans have warned in very stark terms about Chinese corruption, Chinese labor practices, Chinese lending schemes that may be troublesome in the long run. And many of the governments here have said, well, you may have a point on some of those arguments, but what is your alternative? What are the funding streams that you or other countries are going to put forward to help us in our hour of need? And I think as this debate continues to unfold, which I think will happen for years to come, the Chinese are showing up and delivering in Latin America's hour of needs. I think it's very interesting in the early phase of vaccine distribution, desperation was such in many of these countries that vaccine deliveries, the first plane loads of vaccines, became televised events that were covered in the news in real time for hours. So some of the first images that Latin Americans saw of vaccinations arriving to their countries and vaccines being injected into arms were Chinese vaccines, simply because the Chinese were the first to arrive. There's been questions about whether the Chinese vaccine is substandard, whether it has a lower efficacy rate than American counterparts. But at the end of the day, I think the Chinese scored a victory in showing up first and delivering in large numbers at a time when rich nations, including the United States, have been seen as hoarding vaccines and sitting on far more doses than they will ultimately need.
Thank you, Ernesto, for that very comprehensive and also nuanced overview. I saw Minister Anthony also nodding his head while you were making the comment. And we'll go to Ambassador Heine. Do you agree or disagree with what Ernesto just said about the situation?
Yeah, I agree, absolutely. There's something I always tell my students, which is timing isn't everything. It's the only thing. Chinese vaccines are being delivered today. And what does the United States and Europe say? Well, sometimes, perhaps later this year, perhaps 2022, perhaps 2023, and then they will be much better, and they will be in huge quantities. Well, that's no good. The vaccines are needed, as Minister Anthony knows better than anybody, they are needed today. And it seems to me that China has shown to be particularly nimble in being able to deliver them today. I'm also a bit struck by this debate that we see in the Western press, comparing, the Pfizer vaccines, which has a 90% efficacy, with the coronavac vaccine, which is around 70%, and saying, well, you should prefer the Pfizer vaccine. Well, that's a sort of rich country club discussion. What countries in Latin America, in the Caribbean, in Africa, in Asia need is vaccines now, and that, it seems to me, is the important point. And China is coming through on that.
Thank you, Ambassador Heine. And I think on the vaccine point, I'll bring the scientists here at the table, Dr. Boyd, for a comment later on. But let me just go to Minister Anthony really quick, since you were nodding his head at some of Ernesto's comments, and also to Ambassador Heine's point. Please, Minister Anthony, any comment on that?
I think in addition to some of the points that were made, the vaccine, you also have to understand, you got to roll this out, you got to distribute it. And the vaccine from China, whether it's a Sinopharm or Sinovac or CoronaVac, those vaccines, the storage is between 2 to 8 degrees Celsius, which most countries, their cold chain, would have been accustomed to distributing those types of vaccines. And so it was easier also to distribute it quite rapidly. For other countries who might have benefited from Pfizer, although they were very scarce, Pfizer and Moderna, the temperature difference, you had to repurpose your cold chain storage to be able to accommodate that. So in addition to finding the resources to buy the vaccines, you also had to now find resources to build a new cold chain, which is also very important. So I think that's something that we have to also factor into the equation. But countries, if you have your citizens dying, then you want to get vaccines as quickly as possible so that you can immunize them and prevent them from dying. And I think that's the dilemma that everybody faced. We can't keep everybody locked up, have lockdown constantly, because that then compromises more your economy. And trying to have that balance between livelihood and lives is an important one. And we think that by getting vaccines and immunizing people, at least you can restart the economy. So there are a number of factors that are played for countries, and that is, you want to keep your economy going, you want to keep people employed, you want your different sectors to at least work. Other than that, more people are going to slip into poverty, more people are going to become unemployed. And here is the balance. Plus, you're saving lives. So for most countries, we're trying to get vaccines as quickly as possible so that we can try to normalize the situation. I know we are far away from normal, but at least with these efforts, we are taking those steps to get to some level of normalcy. We are far away from that, but at least we're making the right steps. And then, of course, know that from that's not helping at all, because the severity of the disease, it's causing more hospitalization. And this has been challenging in the rollout process as well.
Thank you, Minister Anthony. First, thank you for that comment. Just such a powerful message, and thank you for being candid about this situation. It's just such an important message for countries in the region, but also U.S. government stakeholders and policymakers who are following conversation. Many have signed up for this event. Thank you for that message. And second, thank you for bringing that up about storage and transportation. Once again, we should think about immunization as a holistic issue, from acquisition to transportation to vaccine hesitancy, more on the vaccination side. But here, let me just bring Dr. Bowie in about the point that Ambassador Heine brought up earlier, and also we had this question in the chat as well. Could you just give us a quick comparison between the Chinese vaccines and the more predominant Western vaccines? There has been a lot of different opinions on those and their comparisons online that we read about. What's your professional view on this?
Well, altogether in the world, there are about 10 vaccines being approved in different parts of the world. And there are in general 3 categories. The mRNA vaccine is the newest technology. This is the first time a mRNA vaccine actually get approved by the regulation. And it turns out to be a very high effective vaccine. So Moderna and Pfizer are this type of vaccine. They do need deep freeze condition, so that can create some supply chain issues and transportation issues. The second type of the vaccine is called a vector vaccine. So it's putting the RNA of the virus and putting into a harmless virus and to give it to people. So this is the type that's Sputnik, Johnson & Johnson, AstraZeneca, as well as China's the CanSino vaccine are in this type. This type still usually use 2 dosage, except the Johnson & Johnson, but doesn't need a deep freeze. A general cold chain will be fine. Now, China has another 2, or you could say 3, vaccine that's using the most traditional inactivated vaccine technology. So those would need P3 labs because they basically have farmed the virus and kill the virus using physical or chemical means. And this type of technology is most mature. It doesn't need a deep freeze, but it can produce some delays just because of the high requirement of security on that.
Thank you, Dr. Bui. If I could just ask a follow-up question about specifically efficacy, since that's not also something that I don't fully recognize or understand. To Ambassador Heine's point, do you think this efficacy conversation is kind of a moot point just in the context of what's happening in Latin America and folks are not getting access to any other vaccines? Or do you think that this is something that's worth discussing in terms of comparison of efficacy among different vaccines?
Well, certainly high efficacy will be helpful because the goal is really a very short time. We want to reach the herd immunity so that stop this epidemic, so that the virus will stop mutate. So we now know that Pfizer and Moderna has the highest efficacy, about 95%. And China's Sinopharm vaccine, based on 10 country trials, have about 76%. And Sinovac has a range of 50 to 75%. So if the vaccine efficacy is lower, it will take longer and take more people to get to the herd immunity. But that said, the vaccine also protects people's life. So I think no country has reached that herd immunity yet. So I think hopefully we will reach that, but any vaccine is better than no vaccine.
Thank you for that. Ambassador Heine, please.
Now, we just have some numbers in the case of Chile with the Sinovac vaccine. In the age range, people in the 80s and in the 60s, their death rate after having been vaccinated and hospitalization rate has decreased dramatically. So we're already seeing some numbers on that, making the case that in the end, what I said earlier, the important thing is to have people vaccinated rather than worry too much about the percentages. I'm not a scientist, not a natural scientist, but it seems to me that is an important view that is coming out from the case of Chile.
Thank you, Ambassador Heine. And to your point, let me ask a question to you and also bring in Minister Anthony and it's so important to get vaccinated. I think that's the core message here, and we all agree on that. And since China, as Jason mentioned earlier, is providing the most available, in some cases, the only available product in some of the Latin American, Caribbean countries, that must be having some sort of effect on public perception of it. We've been talking about this at a more government level, but let's talk about public perception in general. Do you think after the pandemic, public perception will be shifting more positively towards China in the region? We'll start with you, Ambassador Heine, and then we'll go to the minister and Ernesto.
Yes, well, there are two things here. Obviously, the initial perception of China after the eruption of the virus in Wuhan was quite negative in the region. And, we have some surveys that tell us that. Now, that said, in the initial phase of providing, PPE and helping Latin American countries to mitigate the health crisis, China was very nimble, provided, I think, over some $200 million to 28 countries in that equipment. At a time when some equipments that were being bought by Latin American countries in China were being stopped, both in Europe and in the United States, and those equipment essentially being hijacked. So it was quite a difficult situation. And now, with that and with what has been happening with the vaccines, I think the perception has changed. There are some surveys that tell us that a lot of people in Latin America, when they hear the word China, the first thing that comes to their mind is COVID and the virus. So that is something that is obviously there. But I would argue very strongly that in terms of government leaders, decision makers, the elites, the change in terms of the perception of what China is able to do. There is something that I learned in my years in China, something called China speed. That is the ability of China to do things and do them quickly. At a time when around the world, it seems to be, it's more and more difficult to get anything done. One of the winning cards of China has been to actually get things done and get that done quickly. And it seems to me that in the case of this pandemic, that is once again proven to be true.
Thank you, Ambassador. And I think China's speed is something that I've certainly seen in some of the other areas, including infrastructure development, especially in the Caribbean. So, Minister, if I could bring you in very quickly, a quick comment on that. In the Caribbean, where do you see public perception of China as a result of the pandemic and as a result of the vaccination? I think we might have lost the minister for a quick second. So let's go to Ernesto first. What do you see in Brazil in terms of public perception?
I think it's split. I think, there's no question when you talk to scientists, mainstream scientists, that they regard the Chinese vaccines as good vaccines, as vaccines that are effective and that should be deployed aggressively and boldly. However, I think there is an alarming number of anti-vaxxers we're seeing in Brazil, where historically vaccines were not controversial, were not polarizing issue. And especially when I speak to supporters of President Bolsonaro, you hear these crazy conspiracy theories about China having created the virus in order to then sell vaccines to people. When I heard this from the first couple of people, I thought maybe I found a couple of loonies. But then the more I kept asking people to share their views on vaccines, the more I kept hearing things along these lines. And they're not relegated to kind of the margins of public opinion or the fringes of public opinion. The pulmonologist who treated me for COVID, a very well-respected doctor here in Rio de Janeiro, when I went for my last appointment, he told me he had recently received the Chinese vaccine, and he said he was very disappointed and that he was very much looking forward to eventually traveling to the United States to get what he called a real vaccine. So I think it's too early to tell just how big of a PR victory this will be for the Chinese. I think, at this moment of need, people are very, by and large, people are very eager to get any vaccine that is available and that has been authorized by health authorities. But I do think that the Chinese still face a significant amount of skepticism about the efficacy of their vaccine. And I think if other governments, especially the American government, were to be able to bring American vaccines into this region quickly, it would get some real points. It would be greeted with tremendous relief and gratitude.
Thank you, Ernesto. First, it's so valuable to have you bringing that on the ground and experience and perspective into this conversation. And second, it's too early to tell, so I consider this an invitation to invite you back for a similar event a few months down the road to talk about where we are. But before that, let me switch gear to Dr. Bui very quickly. I think we talked quite a lot about the geopolitical competition, if you will, Chinese versus American vaccines. But at the same time, many of the panelists also mentioned that this is not necessarily a competition. At the end of it, it's about getting people vaccinated. You've done some tremendous amount of work as a health expert on how China and the US could actually work together in pandemic and global health responses. So share with us some of your quick thought on this. Is this possible in this environment?
Yeah, it can be an opportunity. I would highlight that before, I would say the last few years, China and US global health professionals has been always working side by side since SARS 2003. So they worked together on avian flu, H5N1 in China. They worked together to provide for the H1N1 swine flu vaccine. And they, in 2014 to 16, they work together in West Africa to fight the Ebola. And actually in 2016, right after that, the Ebola, China CDC and US NIH and US CDC has agreement to build Africa CDC, to build labs, surveillance sites. So I see that's what's necessary to build public good to fight a common problem, right? Just like climate change, we see the pandemic can be devastating for both economy and human lives. So I see there's a precedence of many precedents of successful stories in the past. So hopefully, for the future that there will be another successful story.
Thank you for that. And it's certainly my personal view that I'd love to see more US-China coordination, collaboration in regional context for vaccination. I think that will be a great thing to see. As we wrap up this event, let me ask a quick question, 1 or 2 sentences, 10 seconds to all the panelists. This event is mostly about Chinese vaccine in the region, but we've received a lot of interest from US government officials and policymakers. If you have one message you can send them in this 1-2 sentences, what would it be? We'll start with perhaps Ambassador Heine, and then with Ernesto, and then we'll go to Minister Anthony and wrap with Dr. Bui.
The message would be, get US vaccines to Latin America as quickly as possible. 2022, even later this year, 2023, is not good enough. US vaccines are very good. Get them out there quickly.
Thank you. We heard you loud and clear. Ernesto.
I think the message you would hear from Latin Americans is, please help. And the help needs to come soon because these countries are facing just enormous loss on a daily basis.
Absolutely. Minister Anthony.
I think the message would be the same, and that is to get vaccines out to as many persons as possible. As you know, the US had agreed to donate 4 million doses of AstraZeneca to Mexico and to Canada. If the US can expand that in terms of the range of vaccines that it's using and donating, and perhaps get more vaccines and include more countries into that arrangement, that would be a welcome initiative. The US has already started something in, I think, Southeast Asia, where they're working to get 1 billion doses for a number of countries in Southeast Asia. And again, we are right in the US's backyard. And we think that with very few doses, we can change the dynamics of the epidemic in the Caribbean. And with a little bit more doses, we can change it for the rest of Central America and Latin America. So I think it is something that we should be looking at and get more doses as quickly as possible so that we can immunize and change the dynamics of this pandemic.
Thank you, Minister. Very aligned with what Jason said at the top. We see the U.S., we think the U.S. can and should be doing more to support the region. And at the center, we really try to advocate for these efforts. Very quickly, Dr. Bui.
So I think the scientists from Latin America, US, and China can work together to build capacity for resilience and vaccine manufacturing capacity to prepare for the next pandemic.
Thank you so much. Thank you all the panelists for joining us. Just such different rich perspectives and expertise represented here today. We learned a lot. Thank you, Jason, and thank you everyone on my team, specifically Wazim and Ella, for supporting this event. And we look forward to having everyone in a few months down the road. Ernesto, we're taking you up on that.
Thank you.